Hello, you're watching DD News and I'm Anil Thomas presenting the special edition tracking COVID-19 where we bring you all the updates related to the deadly virus that has left the world helpless with its outbreak. As a precautionary measure, Prime Minister Modi announced a 21-day lockdown of the entire nation to ensure that people stay indoors and social distancing. The best prevention aimed at disrupting the chain of transmission is practiced by the people. We get to the latest updates on the measures taken by respective state governments to ensure the threat of COVID-19 is minimized, along with international updates of the pandemic and lots more in the next half an hour. Let's get started. Prime Minister Narendra Modi reiterates the importance of strict adherence to lockdown, interacting with the people of Varanasi over video conferencing. PM issues stern warning to those misbehaving with doctors and other corona warriors. Centre and state announced series of measures to ensure adequate supplies of essential commodities during the lockdown period. Home Ministry holds meeting with representatives of e-commerce companies, assures all possible assistance. Toll collection suspended at all toll plazas. Union Surface Transport Minister takes the decision in the wake of COVID-19 outbreak. Total number of active COVID-19 cases in the country goes up to 553. Death toll at 10. Maharashtra and Kerala record maximum number of positive cases. Ministry of Health urges people not to take any medicine without being prescribed by doctors. Ministry also says there are no evidence of community transfer of COVID-19 in the country. Novel coronavirus continues to wreak havoc globally. Spain surpasses China with record death toll of more than 3,600. Italy continues to struggle to contain COVID-19 deaths. The death toll in Italy crosses 7,500. In the United States, total number of infected persons reaches 70,000 with death toll more than 1,000. In United Kingdom, too, the death toll of COVID-19 touches 500. Britain's Prince Charles declared corona positive. Spain's Deputy Prime Minister tests positive for coronavirus. Celebrity chef Floyd dies in New York after battling with COVID-19. And now for the stories in detail, starting first up with India. The centre has asked state governments to deploy additional medical facilities and fiscal resources for fighting COVID-19. Let us take a look at the latest data regarding the spread of coronavirus in India. The total number of active cases of COVID-19 in India have risen to 593. 13 deaths have been reported due to coronavirus in the country. 42 people are undergoing treatment and they have been cured and discharged from the hospital. The highest number of cases have been reported from Maharashtra with 124 positive cases, followed by Kerala, which has got 109 cases. The national capital, Delhi, comes third there on that list. In Kerala, the total 109 confirmed cases of COVID-19 that include 8 foreign nationals. 4 persons have been cured and discharged, while no death has been reported from the southern state till now. Besides Maharashtra, Kerala is the only state where the number of confirmed cases have crossed 100 mark. In Maharashtra, a total of 124 confirmed cases of COVID-19, including 3 foreign nationals, are reported. 1 person has been cured and discharged, while 3 deaths have been reported from the western state of India as of now. In Mumbai alone, 48 confirmed cases have been registered. It remains the worst hit state in the country till now. The state government has warned people that if they are seen roaming without a valid reason, they will be imprisoned immediately. It has also sealed the district borders, resulting in a long queue of trucks and tempos at the border of every district as well as the state border. The escalating threat of COVID-19 has compelled a nation to be locked down in a bid to combat the virus of COVID-19. Police in Gurugram have been keeping vigil and making every possible effort to ensure nobody comes out unnecessarily. In Noida, people came out to buy their essentials but were seen maintaining social distance. Meanwhile, in Jammu as well, essential services were provided to people without any interruption amid the lockdown. Roads can be seen deserted and people came out to buy only essential things. Jammu and Kashmir police have registered 218 FIRs against violators of the lockdown aimed at stopping or breaking down the chain of the deadly COVID-19. Jammu and Kashmir police is also repeatedly requesting the people to follow the instructions seriously. Besides, in Jammu, Srinagar police hospitals have been established with more helplines for the police personnel and their families for immediate assistance. Meanwhile, Jammu and Kashmir Union Territory Lieutenant Governor G.C. Murmu has also approved a series of measures to provide support to the needy and destitute in the view of the coronavirus outbreak. The steps include releasing 1,000 rupees each of the 3.5 lakh workers registered with Building and Other Construction Workers Welfare Board for purchase of ration for the next 21 days during that lockdown period. It also includes releasing immediately 2 installments of old age, disability and family pension to all the 7.7 lakh pensioners. These measures are in addition to the relief measures taken by the government, including 2 months of ration under PDS, 1 month's advance under the midday meal and the packets for slum dwellers and destitute. The measures are expected to benefit nearly 35 lakh people, including organized and unorganized workers, daily wagers, pension holders and ordinary citizens. AIIMS will soon begin a teleconsulting facility for its patients as it had shut down its OPD, including the specialty service, and all new and follow-up patients registration from the 24th of March till further orders. The facility is likely to be operational by the end of this week. Follow-up patients and chronic patients can consult doctors through this facility. The All India Institute of Medical Science had earlier decided to temporarily suspend routine walk-in OPD registrations of patients from the 23rd of March as part of an effort to redirect its resources to controlling the COVID-19 outbreak. Dr. Randeep Guleria, the director of AIIMS, revealed how to keep yourself engaged as well as mentally and physically fit in home quarantine. Underlining the importance of yoga and indoor recreational activities, he said that healthy lifestyle and awareness can only bring a halt to the spread of COVID-19.
घर के अंदर एक एरिया बना लें जहाँ पे आप घूम के वॉक कर सकते हो. दूसरा इम्पॉर्टेंट इशू इज मेंटल हेल्थ. इसमें ये बहुत ज़रूरी है कि हम लोगों से सोशलाइज करें. घर के और जो परिवार के लोग हैं उनके साथ इकट्ठे बैठ के बात करें. कुछ इंडोर गेम्स खेल सकते हो. कार्ड्स हैं तो कार्ड्स खेल सकते हो. इकट्ठे बैठ के कोई टीवी पे मूवी देख सकते हो. इस टाइप के कई एक्टिविटीज़ कर सकते हो जिससे आप सोशलाइज भी कर लें. ज़्यादा हुआ तो अपने दोस्तों के साथ फ़ोन पे बात कर सकते हो, चैट कर सकते हो, जिससे आप अपने आप को बिजी भी रखो, मेंटली स्ट्रांग रखो और इस 21 दिन में फिजिकली और मेंटली स्ट्रांग रहो. योगा जो है वो आप सुबह उठ के सब लोगों को योगा करना चाहिए, मेडिटेशन करना चाहिए. ये हमारे जो मन में योग कोरोना के बारे में और सोचने से जो परेशानी है वो भी कम होगी. अब हमारी ब्रीदिंग से हमारी लंग की कैपेसिटी भी बढ़ेगी और ओवरऑल पॉजिटिविटी भी शरीर में आएगी.
Let's now once again visit the do's and don'ts that are vital in the fight against COVID-19. Let's take a look at them one by one. You know, persons with no symptoms of coronavirus should not use medical mask. Instead, wash hands frequently. Continuous use of a disposable mask for every 6 hours increases the risk of getting infection. Using medical mask while visiting healthcare facilities or when caring for ill persons. A medical mask is effective for 8 hours. Change immediately if it gets wet. Use disposable masks should be disinfected and then disposed of by burning or by burying it in the ground. Now, what are the things that you need to also follow? Persons with no symptoms of coronavirus should not use medical masks. Instead, they should wash their hands regularly. These are things that we have been time and again telling you when and how to use the mask. So remember all the things that have been told, the do's and don'ts now. A quick look at that once again. The do's and don'ts: practice frequent washing of hands with soap. If that is not available, please use a sanitizer. Observe good personal hygiene, very important in these trying times. Follow basic respiratory etiquette. Cover your mouth while sneezing and coughing. Clean your hands with alcohol-based hand rubs. Throw away tissues into closed bins immediately after use. See a doctor if you feel unwell. Now the don'ts: have a close contact with anyone if you are experiencing cough or fever. Please stay away. Don't do it. Contact with live animals or consumption of raw or uncooked meat. Please avoid. These are things that one needs to avoid. Spitting in public, it's a common thing to see in India, but you should stop spitting in public. Travel to farms, live animal markets, or where animals are slaughtered. Please avoid going to these places. Also, for further information, you can call the control room number 011-239, the number that was flashing on your screens. Also, don't forget to send a mail in case you have doubts with regards to COVID-19. Moving ahead, as the nation moves through an unprecedented lockdown period, it is normal that people may experience anxiety and frustration due to disruption of routine activities. Here are some tips for a successful navigation through this testing time. More in this report.
COVID-19 outbreak. It is very important to take care of one's physical and mental health during home isolation. Make sure you have healthy balanced diet every day and do not forget to hydrate yourself adequately. A sound mind can only be found in a sound body, so exercise regularly at home. Union Minister for Sports and Youth Affairs Kiran Rijiju gives us a peek into his fitness regime during the lockdown.
To prevent coronavirus, we all are staying home but working online. मैं आप सबसे दरखास्त करना चाहूँगा कि घर में बैठे-बैठे फिटनेस को ना भूलिए। ये रोप स्किपिंग बहुत ही आसान एक्सरसाइज है। हर दिन कम से कम 2-3 मिनट सबको करना चाहिए ताकि फिट इंडिया मूवमेंट को भी हम आगे बढ़ा सके और साथ-साथ में आप कोरोना वायरस से भी बच सकते हैं।
Set aside time to spend with each of your children, clearing their doubts, teaching them proper hand washing and safe distancing. Ministry of Health and Family Welfare's free online comic series for children, Kids Vayu and Corona, can be used to create awareness about COVID-19 among children. It has entertaining pictures telling the story of a superhero fighting and defeating the virus. In unusual times such as these, it is normal to feel concerned. Even when you are isolated, stay connected with your loved ones through phone, messages, or online. Do things you enjoy by following a hobby or learn something new. The National Institute of Mental Health and Neurosciences at Bengaluru is offering a helpline number for pregnant and new mothers with anxiety or mental health issues. Avoid watching, reading, or listening to content that make you feel anxious or distressed. Refer to only reliable sources of information such as DD News, All India Radio, Ministry of Health website, and PIB Twitter handle. Fact-check information that you get through WhatsApp or Facebook and do not forward or share doubtful news. Arm yourself with correct information and do not believe fake messages. Be a socially responsible citizen and follow instructions issued by the government. Avoid panic buying and stockpiling of essential items as warned by the Honorable Prime Minister. While venturing out, make sure to maintain a distance of at least 1 meter from other people. Do not fall into online frauds by clicking suspicious links or revealing sensitive information about yourself over phone calls. And last but not the least, become role models to the society by being empathetic to others, avoiding stigma, and acknowledging the hard work of frontline workers. Protect yourself and others from coronavirus. Stay home, stay safe.
Well, for more inputs on this particular story on how the nation is battling a lockdown and how people are finding newer ways, we showed you some stories, but how people are finding newer ways to keep themselves fit. Let's now also get a correspondent joining us on the phone line, Arun Sharma, joining us this morning. Arun, good morning. Arun, considering that we are into, the initial part of people staying at home, a change of lifestyle that people have to follow, what are the advantages and disadvantages of this particular period where people, are spending more time at home, not able to go to work, not able to meet your friends? How are people coping with it?
Well, that's right. To in every move, there are pros and cons, of course, but the biggest advantage as of now with India is getting as of now that, yes, on the call of Prime Minister Narendra Modi, now entire country is locked down for 21 days. 1 day has passed, now 20 more days to go. And yes, you can actually see it on the streets, on the roads. I mean, no vehicles moving, only the people who are into the essential services are only on the road. And that too in the early part of our day, that means early in the morning, you can see the essential services movement is taking place. But yes, people are now becoming aware that they have to be in their homes, because we have seen examples in countries like China, Italy, Iran. They could not break the chain reaction. And that's what India is trying to do. They're trying to just break this chain reaction of COVID-19, because that's the only tool we have as of now that's been discovered, that social distancing is the only mantra. And as yesterday, Prime Minister Narendra Modi appealed to the people via video conferencing and talking to the people of Varanasi. But the entire nation was listening to him at that time also. He shared some of the best practices. He gave a clear message that we have to follow this social distancing and we have to be at home during this Navratri, and for next 21 days we have to be locked down. And various community have come forward, NGOs have come forward. Now they are also serving poor people. I mean, as Prime Minister Narendra Modi yesterday said that you should serve. I mean, every person should serve at least 9 families during this 21 days. So there are various NGOs that have come forward, poor people who are at their homes or anywhere. People are serving them. People are coming out to help them. So this is the best part. I mean, what will a person do at the home? So what they're doing, they're doing this kind of social servicing as well when they're at home. Because yes, when you are at home, you have no work to do sometimes. You might be working from home, but then at times when you are under the 4 walls, you find some innovative and discover some innovative ideas as well to pass time as well. So people are also indulging into indoor games. They're playing games. They're playing. They're passing time. They're spending quality time with their family members. So all these things people are doing. So as you ask me that what are the advantages and disadvantages, the biggest advantage is that India is moving ahead in the direction of combating COVID-19. And yes, 20 more days to go. We should remember this fact. And the mantra should be only one thing, that is hashtag stay at home. So that's the only mantra 130 crore Indians are following, and only essential service are moving on the roads, and we can see the supplies, the supply chain as of now is completely intact. So yes, 20 more days to go. Hashtag stay home is the mantra.
Okay, Arun, since you mentioned staying home, you get a great opportunity to be with your loved ones, but it also, people staying indoors, use various modes of recreation. Some could get into physical activity. The others could be watching, watching the latest, flicks either on, many of the media sites that are available. Having said that, yesterday there were, reports that we heard scatterly about, the speed coming down. Is that particular issue getting addressed on a war footing, considering we want people to stay indoors during this particular period?
Well, that's right. The people are at home. If you're talking about the internet speed, let me clarify this, Anil, that all the digital platforms like Netflix, Amazon, and all these these sites which are providing you online content, they have decided that they will be streaming only on the standard definition format. They won't be going on ultra HD format or high definition format. Of course, the speed is the issue, because when 130 crore people, when they are not physically in contact with each other, when they're using the modes like internet and broadband are the only method to be connected with your official work or with your loved ones. So in that time, most of these online platforms like Netflix, Amazon, they have come forward and they have decided that all the contents will be available in only the standard definition format. That means no high definition over there. So of course there is a need to control the speed, and of course the speed is something which is being struck, because most of the people are online as of now, and they are being connected socially and for office purpose also via this internet mode only. This speed is one issue, but yes, the telecom operators are completely making sure that speed should not be obstructed, and there are various companies like Reliance Jio, Bharti Airtel, they've come out with innovative plans for people who are working from home. They are also providing additional data for people who are working home. You can recharge with some of the specific data, which are some new data plans by these telecom companies. They are offering it. Now MTNL has also come out with a new plan that they are doubling the internet data for you for 1 month. That means if you have a 1 GB plan, they'll be additionally giving you 1 GB more, so that you can use the internet. So yes, the telecom operators are also knowing this fact that internet data is something which is key. If you want people to stay at home, you need to provide them internet connectivity, and therefore they are coming out with innovative packs and recharge plans so that you can stay at home and be connected over the period of time.
Okay, we'll leave it there. Thank you and appreciate you joining us this morning with those inputs there on how India is battling COVID-19. Well, moving ahead, today is the second day of Chaitra Navratri. Goddess Brahmacharani, the second form of Ma Durga, is worshipped on this day. However, most of the temples across the country are closed for the devotees due to lockdown. This is probably for the first time the festival is celebrated on such a low-key and indoors because of coronavirus outbreak and subsequent lockdown across the country. In the national capital, no devotees were seen during the morning prayers at the famous Chhatarpur temple, while in the Jhandewala temple, very few devotees thronged to worship Goddess Brahmacharani on the second day of Navratri. In Mumbai too, very less devotees or no devotees were seen in Mumba Devi temple due to COVID-19 outbreak and lockdown. Moving to how the world is fighting COVID-19, senior US diplomat Alice Wells today echoed Prime Minister Narendra Modi's call to keep fighting spirits high against the COVID-19 pandemic. Alice Wells in a tweet said that the US will work shoulder to shoulder with India to combat the COVID-19 outbreak. She further wrote, "Together we can safeguard our citizens and people everywhere." Union Health Minister shared an emotional appeal over reports pouring in from Delhi, Noida, Warangal, Chennai, etc. that doctors and paramedics are being troubled in residential complexes and societies on Twitter. Let's listen in.
आज मैं बेहद दुखी हूँ, मन अशांत और व्यथित है। अपनी जान जोखिम में डालकर दिन रात कोरोना वायरस के मरीजों के इलाज में जुटे डॉक्टरों के साथ बदसलूकी इस सभ्य समाज पर किसी धब्बे से कम नहीं है। बीते कुछ दिनों में कई जगहों से कोरोना मरीजों के इलाज में जुटे डॉक्टरों के साथ बदसलूकी की खबरें आई हैं। कुछ लोग डॉक्टर्स और नर्सिस के साथ सामाजिक भेदभाव का वातावरण बना रहे हैं, जो हम सब के लिए शर्मनाक है। मेरा हाथ जोड़कर आप सभी से निवेदन है कि अपने मन से डर निकाल दें कि कोविड-19 के मरीज़ों का इलाज करने वाले डॉक्टर और मेडिकल स्टाफ इन्फेक्शन फैला सकते हैं। वो सब प्रकार की सावधानियां ले रहे हैं। मैं आपको इसका विश्वास दिला सकता हूं, इस वक्त जब पूरी दुनिया कोरोना जैसी महामारी से लड़ रही है, हमें एकजुट होकर मजबूती से खड़े रहने की ज़रूरत है।
Well, that's all we had time for, but here are some ways we can help the society in this times of pandemic. Stay home. Remember the saying, home sweet home. Bye-bye.